Well, welcome back. Now we're going to have another conversation on access to services, mental health in emergencies. With us in the studio to unpack that particular conversation is Uzamaka Nwachuku. She's a psychotherapist. Good morning and welcome.
Good morning.
Thank you for joining us.
Good morning.
Good morning.
So when we talk about emergencies, what situations are we talking about? Emergencies in mental health.
Okay, we are talking about natural disasters, the earthquakes, the tsunamis. We're also talking about pandemics, like we witnessed the COVID-19. We're also talking about conflict. We're also talking about war zones. But the area we're not actually looking at is personal trauma. Yes, the natural disaster is huge on its own because it displaces people. Somebody just wakes up, flooding occurs, you lose your identity, you lose your house, you lose your certificate. Hopefully you find yourself in the IDP camp sharing, exposure to mosquito infections and all sorts of abuses that goes on there. It's huge on its own, and it's an emergency and it's a crisis on its own, just like the Borno flooding, which our organization were the first responders. It was horrific. People were crying. People were looking for their children when the flooding occurred. And there were lack of basic needs like mosquito net, shelter, food, which actually takes over the importance of mental health in emergencies because they have to eat first, especially when they don't know what mental health is all about. What are you going to tell the person when the person has not sorted out where they're going to sleep, like shelter, basic need? So it overshadows the need and the importance of mental health, thereby obstructing their emotional healing, their resilience in the community. But the emergency I would like to focus on is personal trauma because it's personal to you. We witness or have our own mental health crises and emergencies people don't talk about and people don't rally around to help us because obviously natural disaster is something the world is more interested in that will go out there in the world and global news. But when somebody is diagnosed of a medical condition, is that person's mental health crisis? You go to hospital. I've heard people say that they will ask them, okay, let me just do eye checkup normally. And they will do the eye checkup and they will tell them they have glaucoma. At that point, is that person's mental health crisis? What about grief? What about bereavement? What about terminal illnesses? So somebody will go to work and will get a letter. Your services are no longer needed. They will pay you upfront. At that moment, that person has witnessed his or her own mental health crisis emergency. And these are the emergency and crisis people are not actually talking about, and it's peculiar to them and can put many into mental health conditions if care is not taken. So the emergency could be both the world emergency and personal trauma.
Right. So now, talking about these emergencies, how common would you say are mental health challenges that arise from crisis, and what are some of the signs that people or community should look out for?
Okay, over here we don't usually witness natural disaster apart from the one that happened in North Benue and all that. Like I said, what we witness here that people don't even know are personal traumas. And like I said, you don't need to wait for signs. That is why when you want to tell somebody they have something like cancer, mental health should be part of the first responder. You should have somebody close. You don't just tell people they have this without caring about what it does to them. So when you are looking for signs, you are missing it. When you are looking for red flags, you are missing it. And remember, mental health conditions, no, they show for face. It's not written on the face. It's something somebody have to open up about and talk to you about. So there are some things that before we get involved in, just like we have our primary care centers. Primary care center are the first responders when it comes to healthcare services. But are we embedding mental health care services for emergencies? So if you have any emergency, for example, they call the primary health care people. Where are the mental health people? So we don't need to sit down and wait for the red flags. We need to start embedding mental health in every sphere of life, in schools, in hospitals, in churches, in offices, in organizations, because it doesn't show on anybody's face. And trust me, with the existing stigma, with lack of awareness and education, nobody will open up to you, nobody will tell you anything. So sitting down to wait for red flag is not the solution.
All right, now that you mentioned stigma, how would you say the stigma surrounding mental health illness actually prevent them from seeking professional help?
Okay, first of all, when you talk about your problem, people see you like you are weak, especially for a man. How can you be telling people that you're having challenges? How can you be telling people that you can't feed your family? How can you be telling people you need financial assistance? You understand? You're a man, you should handle it, you should man up. So people naturally like hiding their problems and presenting that they're okay. Everybody wants to feel good. Everybody wants to feel okay. So what fuels the stigma is fear of being judged, fear of being misunderstood, fear of people maybe thinking that you are calling for attention. It happens a lot on social media. Attention seekers. Somebody will be serious and probably saying something that is life-threatening. They tell, don't mind them, attention seekers. They want followers, they want comment, but the person is serious. So all this fuels the stigma, especially being perceived as you are weak, sign of weakness. So people don't bother speaking up. Sometimes it could be that they've spoken up before and they were neglected, they were ignored, they were not helped. So they have not learned how to cover their challenges, and they vowed never. In fact, when you go through what people tell us, they will tell you, I will die with this. I will die with this secret. I will never talk about my abuse. My mother never knew. My family never knew. I will die with this secret to my grave. So you can imagine that kind of life, how it would be. So the stigma of being misunderstood, judged, seen as weak, fuels the stigma.
Now, you mentioned earlier that, you know, when breaking certain news to people and all of that, there should be a mental health therapist or someone, you know, that can help the person's psychology as well. Now, what, apart from the role of this psychological first aid in situations, how can ordinary people who are not mental health therapists, how can they be empowered to offer this type of support safely?
Okay, honestly, that is where the work is. That is a collective effort, both on the government side, both on the NGO side. We need to come together. For example, my NGO, we've started doing that already. We've brought out so many initiatives we are using to tackle such challenges. And that is why we also opened up our mental health academy called Koli Mental Health Academy, where we offer trainings on all mental health workshops. You know, you can become first responder, you can notify the basic and initial signs of mental health conditions, and we are certified by the UK therapists to offer such training and workshops. Talking about our initiative, we started doing what we call mother-to-mother support, mother-to-mother initiative, where we handle our maternal mental health. We empower the mothers, because sometimes when you sit and wait for help, it will never come. So we encourage self-help behaviors. You need to start helping yourself. How do you help yourself when you don't know? We now brought out the initiative called Support for Caregivers Initiative. And we started doing that. In fact, over the last 2 weeks, we've been to different communities here in Enugu, training the caregivers, the health centers, workers. And we are thinking of even passing it down to normal youth leaders in the community. Religious leaders in the community. Is no longer a time you wait for government. It's a time we need to call everybody, at least give them the initial training and helplines. Do this and now call this number so that we can come in here. So we have started those initiatives, and trust me, they are going a long way. And from our experience, when you even talk to the caregivers, I don't want to talk about their mental health. I don't want to talk about the expectations of them. I don't want to talk about the knowledge, the little knowledge they have about, you know, mental health challenges and all that. So it was a huge support. We also sustained that through offering them the courses through our academy and through our Facebook and WhatsApp communities. So we need more trainings, we need more hands, we need more support, we need more collaborations to achieve that.
All right, now Nigeria reportedly has, you know, fewer therapists, let's say about 300 up to 200 million persons in Nigeria. So how can we talk about access when, you know, there is such an alarming human gap when it comes to mental health?
It's not peculiar to Nigeria. Even abroad, before you could see a counselor therapist, it's taking 1 year. It's a fact. So it's not a Nigerian thing. Now, when you talk about Nigeria, how many psychologists do we have? How many psychiatrists do we have? Even World Health Organization said that there is a shortage of 5 million mental health workers. Shortage. And in low-income countries, is 1 psychologists to 100,000 persons when life is normal, no crisis, no emergency. So we're already suffering this shortage in mental health workers. So imagine when we now have crisis, that we need more hands on deck, we need more support. So it's not a Nigerian thing, but it's appalling because the demand can never be met. We can't even start to talk about saving the world or saving people. So it's a general problem.
But what, sorry, excuse me, Uche, but why do you think this mental health issue is not getting the attention that is needed? Because most times when you go abroad, when there is an issue, you hear things like, oh, call 911, call 911, call this, call that. But when it comes to Nigeria, reverse is the case.
Because Nigeria doesn't know what mental health is. I keep saying it. People think that mental health is mental, they think it's madness. They're not interested in the topic. They feel they are okay. You understand? So we've not even started the awareness. Even in Enugu alone, we've not even started the awareness. We've not even started the education. Trust me, just barely 5% or 10% are aware of what mental health. Most people are people that are exposed, that would say, okay, I know what you're talking about. And each time, people are not interested, but the few listening ears, when they understand it, they say, oh, this is actually about stress, what I go through every day. So we need more campaigns. We need more awareness. We need more education. We need more media platforms like you've provided. Let's talk about it. Mental health is a good condition. It's a way of fighting for your well-being. It's your garden that you should protect and not allow stress to overwhelm you. So is this major lack of awareness and education that is actually affecting us here in Nigeria?
All right. Now, before I ask what I want to ask, I just want to know, from what you've said now, how receptive are people to these outreaches that you do? In as much as we are creating the awareness and talking to people about it and they are getting to know, but when you look at the number of people you speak to and then you check the ratio of people that actually are accepting of it and are ready to take it as a serious thing, how is that ratio like?
Anybody that have listened to us doesn't want us to go, because it's a different of what they felt mental health is all about. What we do, we don't just start, we call it psychosocial outreach because of the stigma. If you tell them we are coming for mental health talk, you won't see anybody there. So we say we are coming for psychosocial support, we are coming for psychosocial outreach. Then when we now come in, we start talking about, we now make it as a conversation. We no longer teach. Before, when we come, we put the screen, we put the board, you teach people. No. We now start the conversation. We bring people, we build it as a community. Let's talk. What are your challenges? Do you go through stress? What are your main stressors? From talking about it, we discuss and talk about way forward. Before we bring in mental health, they now understand, okay, this is what mental health is all about. Oh, okay. They will not want us to go. They want to be part of us. They are going to come and, train more. So that's how we do it. But the issue is now getting that population, getting the audience, getting the community and all that. And we started with the healthcare centers. And there was one we even did at Abakaliki last 2 weeks for the parents of special needs children.
Okay.
And all that. So yes, we find different ways of coming in, because if you use mental health outreach, mental people don't really know what it is.
So it's easier for them to be receptive of what you're saying. Okay. Yes. Now, during COVID-19, I think the COVID-19 pandemic opened up, this online and digital mediums to do a lot of things, and online therapy became, a lifeline for a lot of people. So how would you say that digital tools or teletherapy can be used to bridge this mental health access gap, during emergencies and even in our rural communities or displaced areas?
In fact, that is what is needed mostly now, because you can't be everywhere. That is the truth. If we did not have our focal person in Borno, there's nothing we could have done. And another thing, even if you go to Borno, what about language barrier? So have you seen that it's a huge work? So we need more innovations. We need more digital mental health apps and all that. And we have just few of them, and people don't even know about them. People don't even know how to access them and all that. There are just quite few of them. And this is exactly what we need, especially for rural areas where you can't access or where language is a barrier, so that when they call, they can have somebody speak to them in their own languages they will understand. Because once you speak their language, they will trust you. They will see you as a spy or kind of understand where some can't even hear English, some can't speak English. So when they call, you can offer initial counseling to them to calm them down, to help them know that you're not alone, I am here with you. So this is time for innovations when it comes to mental health. It is needed more than ever, especially for rural areas that has problem with road network, communication problems and all that.
All right, now as a psychotherapist, what kind of approaches or therapies do you think are most effective?
Okay, it depends on the audience. It depends on the individual. For example, when it comes to children, I use play therapy. Adolescent, I use play therapy. There was a parent that said, oh my God, I'm losing my daughter. I don't know what to do. And I've told her that she will come for counseling. Not that I've killed her. Even if she comes, she will give me textbook answers and all that. And I said, okay, just tell her to escort you to my office. You want to see a friend. When the lady came, I looked at her, a young girl that just finished secondary school. And I started engaging her and I brought Scrabble. I said, you know what, let's play Scrabble, play therapy. From playing the Scrabble, I'm interacting with her, asking her questions, telling her the things I did in my secondary school. She was like, wow, not that you people are learners, you've not even done anything. Now we do it. So you win her trust or his trust, get her to open up and tell you things people don't know about. From there, she doesn't even know she's going through counseling. So we have different strategies, we have different approaches depending on the particular thing the person is going through. They are tailored and different types of therapies. So it's not like a one-size-fits-all problems. Yes, that's why also you get people to fill forms so you know where they are coming from.
Yeah. Now, when we have these issues of emergencies or crises, it's as if once it ends, and the therapy is done and that moment or that period passes, attention just shifts from the entire mental health recovery. Even when it comes to normal therapy, once the person seems to have gotten over that phase, the entire mental health recovery just seems to stop at some point. Now, is there a way to ensure some form of continuity of care for people who have been to therapy or survivors long after that phase is over?
Sure. In fact, any program that is not sustainable, don't trust that program. Because we first of all tell people how we intend to sustain this. How have we been sustaining it? We sustain it through different initiatives, like I told you. You must keep them in a community where you must keep checking on them, sending them daily mental health tips. Because like I said, mental health challenge is not constant. If I say that you are okay, you can never be okay with mental health challenges because events can occur. Events can keep occurring. So it's not something you leave people and say that they are okay. At every point in time, we all need mental health support. And we're doing that through our various communities. And we also engage people. We've had one-on-one interaction in coming in to do content creating for us. Like tomorrow is the International Day of the Girl Child. We reach out to them. They feel happy that you remember them. They feel happy to be part of what you're doing, to lend their voice and talk. So you don't just leave them, you carry them along, get them involved. If you are doing conferences, we bring them in to come and sit. You don't just throw them away. So we make sure we sustain them by constant communication and giving them responsibilities and inviting them for programs as well.
All right, now I want to understand all these mental health issues. Do you think it is hereditary?
Of course. There's one that we call the genetic mental health disorder that runs in the family. Even depression can be genetic. When an unhealed parent who didn't handle his trauma, you can pass it down, yes, to the generations. Of course, it's genetic and runs in the family. That is why you can start by breaking it now with you. So you don't be an adversary to your born children or your children.
Now, we know that you're a psychotherapist. Now, how do you manage your own, mental health state while you are also attending to millions, say thousands of people?
I lose it sometimes, that's the truth. I lose it sometimes. But being a mental health practitioner has helped me. I'll be like, now you be this. No, you tell somebody now, no, do this one. So there is that consciousness that helped me, to know what to do. And it all starts with emotion. If people could know about their emotions, learn how to pause, name their emotions, breathe, relax before making any decision, it helps. So nobody is perfect. We all lose it, but there is that consciousness. And also, I don't play with my self-care. I'm a self-care guru. I tell people, I know where to set my boundaries. I know when I'm losing it. Oh, I have to stop and take care of myself. In fact, I tell people, you matter. You have to fill your own cup. I know when to fill my own cup. I know when to withdraw and say, hey, I need to be okay for you to be okay. So I'll take care of myself. So self-care helps me to balance my work life and my personal life, and it's intentional. You have to be intentional about it. So.
Speaking of self-care, now a lot of people wonder, what is this self-care? Because I mean, while we're talking about access to service, mental health, in emergencies, and you mentioned earlier about teaching people about self-help, how can an average person who is trying to maintain a good mental health balance imbibe this self-care or self-help measures?
Okay, let's start with things that don't or won't cost you money. For example, exercise. There was a time we put up, people should vote a poll we posted on how they manage their stress. They answered every other thing: prayer and meditation, rest, sleep. Nobody answered exercise. So it gives you an idea of how we downplay the importance of exercising or sports, which is holistic on its own, because it takes care of almost everything, mentally, emotionally, psychological, everything. It takes care of you. It gives you the sleep mode regulation, it regulates your sleep, your body, gives you all the feel good hormones and all that. But that is what people are neglecting, because I am guilty of this. So it's not easy to exercise, especially when it becomes a daily routine. People don't really like routine. So something like exercising, for example, you need 10,000 steps a day for blood to circulate in your body for the whole day. So each time you're not exercising, you're stopping blood circulation. You're kind of killing yourself. That's why sometimes you say you have back pain, neck pain, because blood is not circulating, and blood is carrying the oxygen and the nutrients that you even eat from the food. And blood is meant to circulate in the whole part of your body. So when we're not exercising, we are killing ourselves. So exercise is part of self-care. Sport is part of self-care. Rest. I'm just talking about the simple one.
Yeah.
How are we resting? Sometimes when you talk about rest, people think it's going to lie down. You can rest emotionally by seeking for support and help. You can rest mentally, by meditating, mindfulness practices and all that. You can rest socially from digital rest. Go away from social media and take some time. You can have alone time and reflect on yourself. You can even rest creatively, do what you like, do your hobbies. So there are different ways one can rest by engaging in activities and hobbies they like. Also, self-care, that thing you like doing, your hobby, if it's shopping, if it's window shopping like us, go for window shopping, if it's talking to a friend, building your resource, speaking to people, that thing that will calm you, put you in a good place, the resources, that is self-care.
All right, now in 2023, Nigeria actually passed the Mental Health Act after a whole, after a decade of advocacy. Now, do you think that that law has actually translated into better access, or do you think it's just talks? And what kind of reforms or policies do you think that the government can actually implement to, properly help mental health?
Trust me, nothing has been done. And the amazing thing that even when you meet doctors, they have that gap of, mental health. People are more interested in, I've had to talk to some of the people, they'll tell you, go to psychiatry. It has gotten worse. That is not our work. Our work is to prevent. So government should advocate for prevention, problem solving, not when it has gotten out of hand. The person is already addicted. The person is already, going through the mental health illnesses. Then you now come and start building rehabilitation centers. There are ways to reduce costs to our health, which is by preventing this from escalating to rehabilitation centers and psychiatric hospitals. So I think government should work on their primary health care, which they are the first responders. Make it a law that mental health must be embedded in everything you are doing in any healthcare sector. Like I said, how can you go to a hospital and a doctor is telling a patient that you have a terminal disease, terminal illness, and you're not thinking about the psychological effects, or the well-being, or the counseling unit where you can, okay, I've told you this, assess this our counseling unit. It will help you to heal. It will help you to, go through the process healthy and all that. So we need more policies on advocating for mental health to be in all the health units and healthcare units and all that, be in schools, be in hospitals, be everywhere, offices, organizations. That is where we can do this prevention so that people can start hearing about it. It will help, because when you talk about addictions, it's just a coping mechanism. People are tired, people are struggling, people are suffering, they don't know what to do. So what do they do? The easiest thing is to go into any available addiction or help to calm themselves down and all that and feel good about themselves. But they are creating more mental health problems and challenges for themselves. So I think it's high time we need to start putting the importance of mental health in everything we do in this society, in every sphere of life.
Yes. Now, of course, you've worked with individuals who have faced some form of trauma or the other, from different situations, crisis or personal trauma situations. Now, is there any experience or story that highlights for you why this mental health support should never be sidelined in emergencies that you'd like to share?
Yes, like I said, it's still based on personal trauma. I've had a cousin who grew up with an aunt that actually traumatized when she was single, going to school and all that. And when she came over to my place as a young girl, I wasn't even a mental health practitioner. When she sleeps, she talks. When she sleeps, she wakes up, she's afraid. When she hears any horn, she's afraid. She thinks it's the auntie that is coming in. Even as she's sleeping, she's hearing the aunt's horn in her being, because at the end of the day, all are connected to the brain. She talks and all that. And now when she now opened up and told me everything the auntie did to her, it traumatized her and gave her low self-esteem and all that. How can you be beating a girl child, taking away her personal belongings that her family bought for her, even down to her rollers and all that? There are some things you will hear, you know that this person's life needs saving and all that. So I watched her go through her PTSD. I didn't even know what it was all about. I could see someone that was scared. I could see someone that was hearing voices, her auntie's voices in her head. I could see someone that everything she was doing, every life she was living was for her auntie, and everything she has told her, you never turn out good, and all her life she has been living to, kind of prove what she has said wrong. Yes, I've met such cases.
All right.
Wow. All right. Thank you very much, Uzamaka Nwachukwu. Thank you for joining us in the studio.
Thank you for coming.
Thank you.
My pleasure.
And now we have come to the end of that conversation in regards to Mental Health Day. Now we'll go on a short break. Do stay with us.